Hey everyone, so I'm going to explain to Mr. Jones the patho of primary, secondary, and complicated hypertension. So hypertension is a common condition in which the blood pressure is high over a long period of time, causing a long-term force of the blood against your artery walls. The blood is being forced high enough that it may eventually cause health problems such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. Arteries are blood vessels that carry oxygenated blood from the heart to the body's tissues. The more blood your heart pumps and the narrower your arteries are, the higher your blood pressure will be, making it harder for your vital organs to receive oxygenated blood. Normal blood pressure for adults is 120/80, and you can have high blood pressures for years without any symptoms. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attacks and a stroke. In regards to primary or essential hypertension, for most adults, there are no identifiable cause of high blood pressure. This type tends to develop gradually over many years. Factors that can play an important role in this type of hypertension include genetics, which is your family history, your lifestyle, and increased dietary salt intake. Secondary hypertension is high blood pressure caused by an underlying condition. Various conditions such as kidney disease, adrenal tumors, and other conditions and medications can lead to secondary hypertension. Complicated or malignant hypertension is considered a medical emergency and must be treated immediately. This condition is when your blood pressure is extremely high and develops rapidly and causes some type of organ damage. A person with malignant hypertension has a blood pressure that is typically over 180, is typically above 180 over 120. The cause of this can be missing doses of blood pressure medications, certain medical conditions, and use of illegal drugs. So some significant clinical information related to Mr. Jones' hypertension is the fact that he is African American. He does not exercise regularly, and he gets short of breath with activities. Also, his age is a factor due to Mr. Jones being in his 40s and his hypertension has been uncontrolled for so long. Another factor that contributes to his hypertension is his past history of smoking, his drinking habits of alcohol, his weight gain of 20 pounds, and his lack of care towards his diet. A complication of hypertension, if not treated, is a heart attack or a stroke. High blood pressure can cause hardening and thickening of the arteries, which is called atherosclerosis, which can cause the arteries to narrow due to the buildup of plaque. This prevents oxygenated blood to travel to its vital organs, including your brain and your heart, which can lead to a heart attack, a stroke, or eventually heart failure. A way to prevent this is by managing your blood pressure, making sure you go to your regular scheduled doctor visits, taking any prescribed blood pressure medications as prescribed, and also by eating a healthy diet, such as green leafy vegetables, fruits, fish, and lean meats. Regular exercise for at least 30 minutes a day, 3 times a week, can also help control your hypertension. And also not smoking and maintaining a normal healthy weight will help control your hypertension.